Don't give up. We have a lot of professionals that are willing to help you. This is obviously a very important thing from our side because if we're able to cut down on the amount of smoking that people are doing or eliminate it completely in their life, we know that over time that their risk of developing these types of diseases drops dramatically. And so it's in our interest to try to help them do that. And so we have a lot of different ways of doing that. And to simply ask. And if something hasn't worked in the past, that's okay. We can try something else. There are a lot of different ways of going about trying to quit. But simply because you've not been able to do so at one point doesn't mean that we shouldn't try again.
I think it's important to try to understand that there can be feelings of despair or disappointment with oneself if you've tried and failed. But understanding at least that part of it is biological and that it is a physiological addiction to cigarette smoking. I think I tell my patients that because that there's that biological component to it, they shouldn't blame themselves if they're unable to quit. And I would also add that it's never too late to quit. Dr. Puriat had talked about the benefits of accruing immediately. Cancer specifically, we know that even at the time of diagnosis, there have been a number of studies, but more recently published studies have shown that quitting smoking, even at the time of diagnosis of lung cancer, dramatically improves the chance of living longer. In some studies, the benefit is about 10 to 20% improvement in survival at 5 years out from diagnosis.